NZS 8134-2021 Ngā Paerewa Health and Disability Services Standard Hospice Services. Please join us for the Manatu Haora Ministry of Health karakia. Fire, 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 ngā uratanga o te Manatu Haora. Ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokiri nai tahi. Kia tae atu tātou ki pai tata, ki pai tawhiri, ki pai ora. Kia tuturu, kai whakamoa, kia tīnā, tīnā. Haumae, huie, tākie. He waka iki noa, a canoe which we are all in with no exception. No mai, haere mai. Welcome to this presentation on New Zealand Standard H134 2021 Ngā Paerewa Health and Disability Services. A decision was made to pre-record these presentations based on previous feedback from live online sessions. Please use the certification at health.govt.nz email for any direct queries about this presentation or the standard. The purpose of this presentation is to give hospice service providers an overview of Ngā Paerewa. This includes a summary of the standards mapping and how the transition to the new and partially new standards will be initially audited. There are also links to resources and templates for your reference. The Health and Disability Services Safety Act 2001 requires regular review of the Health and Disability Services Standard and Fertility Services Standard. Reviewing these standards regularly is important to ensure that they reflect the current services being provided today and continue to work for health practitioners, service providers, and those using the services in their whānau. In 2017, the Ministry of Health began a significant review and consultation process with the health and disability sector, including health practitioners, service providers, advocacy and support groups, iwi, and the people in whānau who use our health and disability services. The review provided the health and disability sector with the chance to ensure the standards are flexible enough to reflect current accepted best practice and incorporate changing ways of delivering high quality care and support. For more information about the review process, please visit the Ministry website. Other standards also brought into the review included the home and community support sector, as they have some crossover into their services. For this reason, the Home and Community Support Sector Standard NZS 8158-2012 was considered as part of this review with the support of the sector. Following the passing of the Abortion Legislation Act 2020, the role of regulating abortion services transferred to the Ministry. Its interim standards for abortion services in New Zealand were also included in the review. Following an agreement from the sector, the 2021 standard combined the following four standards into one, which significantly reduces duplication and variation across the services. The four standards are Health and Disability Services Standard NZS 8134-2008, Fertility Services Standard NZS 8181-2007, Home and Community Support Sector Standard NZS 8158-2012, and the interim standards for abortion services in New Zealand. The 2021 standard applies to over 650 different providers, including fertility services, primary birthing centres, hospices, overnight inpatient services, both public and private, age-related residential care services, residential mental health and addiction services, and disability services. The standard is also fit for use by home and community support services and abortion service providers in Aotearoa, New Zealand. The Standards Approval Board approved the 2021 standard on the 4th of May 2021. The Minister of Health approved the 2021 standard for use under the Act on the 24th of June 2021. The 2021 standard will become mandatory on the 28th of February 2022. A PDF of the standard is available to download from Standards New Zealand website. The Ministry has funded the ability for the sector to download the PDF without cost. A hard copy can be ordered from Standards New Zealand website for a fee of $68. It is intended that the standard will remain dynamic, reflecting current accepted practice. Regular reviews will be undertaken to ensure that this is achieved and that the standard remains appropriate and applicable. The standard represents the minimum requirements necessary for a fair and equitable health and disability service that aim to improve experience and outcomes of people and whānau and reduce care variation. The revised standard reflects the fundamental shifts towards person and whānau-centred health and disability services. People are empowered to make decisions about their own care and support in order to achieve their goals, and there is a stronger focus on outcomes for people receiving support care. The standard has been arranged into 6 sections, and guidance has been produced to support the sector on each of the sections. Guidance on the standard has been arranged into 6 sections. Section 1, Our Rights. Section 2, Workforce and Structure. Section 3, Pathways to Wellbeing. Section 4, Person-Centred and Safe Environment. Section 5, Infection Prevention and Antimicrobial Stewardship. Section 6, Restraint and Seclusion. Sector guidance aligned with the 6 sections of the standard can be found on the Ministry of Health Ngā Paerewa website. The health and disability system is committed to fulfilling the special relationship between Māori and the Crown under Te Tiriti o Waitangi. Ensuring that the standard supports health and disability service providers to honour Te Tiriti was the aim of the most recent iteration of NZS 8134. Te Manatū Hauora, the Ministry, have partnered with Te Aparangi to create online resource sessions for Te Tiriti. An e-learning webinar to help support the sector is due out in February 2022. The principles of Te Tiriti o Waitangi, as articulated by the courts and the Waitangi Tribunal, provide the framework for how we will meet our obligations under Te Tiriti in our day-to-day work. The 2019 Hauora report recommends the following principles for the primary healthcare system. These principles are applicable to the wider health and disability system. The 5 principles that apply to our work are Tino Rangatiratanga, the guarantee of Tino Rangatiratanga, which provides for Māori self-determination and mana motuhake in the design, delivery and monitoring of the health and disability services. Equity, the principle of equity, which requires the Crown to commit to achieving equitable health outcomes for Māori. Active protection, the principle of active protection, which requires the Crown to act to the fullest extent practicable to achieve equitable health and outcomes for Māori. This includes ensuring that its agents and its treaty partner are well informed on the extent and nature of both Māori health outcomes and efforts to achieve Māori health equity. Options, the principle of options, which requires the Crown to provide for and properly resource kaupapa Māori health and disability services. Furthermore, the Crown is obliged to ensure that all health and disability services are provided in a culturally appropriate way that recognises and supports the expression of Hauora Māori models of care. Partnership, the principle of partnership, which requires the Crown and Māori to work in partnership in the governance, design, delivery and monitoring of health and disability services. Māori must be co-designers with the Crown of the primary health system for Māori. The principles-based approach informed the revision of the standard. These principles guided discussions, informed debate and helped achieve consensus during the sector-wide engagement phase of this review. The 5 principles are achieving Māori health equity, Te Tiriti principles, Kawanatanga, Tino Rangatira, Orititanga, underpin the standards. accessible health and disability services, people in whānau, regardless of culture, gender, disability, age, sexual orientation, ethnicity, economic situation, or geographic location, have timely and equitable access to appropriate health and disability support services. Partners with choice and control. People in whānau using health and disability services have their rights upheld to make choices about their care and equity of health and wellbeing outcomes. This principle can be rephrased as nothing about us without us. Best practice through collaboration. Appropriate care includes understanding of the lived experience of people in whānau and shared decision making with them. Standards that increase positive life outcomes. The standards reflect the interaction between people in whānau and their health, well-being and disability support needs. One of the key things the 2021 standard is asking for is greater evidence that service providers are developing, strengthening and maintaining relationships with Māori. As you can see in this slide, the review has provided more definition and criteria descriptions to assist strengthening and maintaining relationships with Māori, with auditors now able to look for measurable evidence as opposed to the previous standards' slightly subjective intentions. Bringing greater fidelity on statistics for Māori health will support realising the intent of the principles by being able to monitor service delivery and assist in measuring equitable health outcomes for Māori, including where any service delivery improvements are required. Providers are required to apply to Health Cert for certification and to be audited against the Health and Disability Services Standard. These audits are conducted by an auditing agency designated under the Act, referred to as Designated Auditing Agencies or DAAs. Audits assess the provider's compliance with the standards to ensure residents are provided with safe and appropriate care. These audits are submitted to Health Cert for review to make a determination of the certification period for the provider and any other conditions they will be subjected to. A certification period ranges from 1 to 5 years. In addition to the main certification audit, providers must also undergo a surveillance audit, which occurs in the middle of the certification period. Surveillance audits are against a core set of high impact standards, as well as reassessing any shortfalls from the previous audit. The Designated Auditing Agency Handbook prescribes the Health Cert certification audit framework. There are 4 types of audits. Certification is an audit against all criteria within the standard. This audit determines the certification period between 1 to 5 years. A surveillance audit is a midpoint audit against a subset of criteria. These differ slightly by service type. For example, aged residential care and residential mental health and addiction services are unannounced and completed 3 months either side of the certification period's midpoint date. Or providers that are funded by the Ministry's Disability Support Services use developmental evaluations in lieu of our surveillance audit template. All other service providers are announced audits and completed by the midpoint date. A partial provisional audit is an audit against a subset of the standards focused on a new environment. They are undertaken when a certified provider either builds an extension, adds rooms in an established facility, or adds a certified service type, for example, certified for rest home services already and wants to add hospital services. An uncertified provider has built a new facility. Provisional, an audit against all criteria that occurs when a certified provider is selling, and these audits result in a 1-year period of certification. The surveillance audit criteria for Ngā Paerewa includes the majority of the 2008 standard surveillance criteria. Tiriti related requirements have been included in the Ngā Paerewa surveillance audit criteria to ensure cultural safety is maintained. This will also support service providers to plan for and implement these new requirements. Surveillance audit criteria applies to service types in accordance with Ngā Paerewa's criteria application framework. So what does this mean for service providers? Your decision-making should continue to be underpinned by the auditing principles. Continue to use your judgment to determine the intention of the criteria is being followed. The criteria is outlined in the Hospice Service Summary of NZS 8134-2021, aligned with the sector guidance 6 sections. We are taking a non-punitive approach to transitioning to Ngā Paerewa requirements. The proposed implementation transition plan's non-punitive approach includes the following. Mapped criteria will continue to be audited as usual and attainment in line with current audit practice. A short grace period will be implemented for partially mapped criteria. The provider will be required to evidence what actions they are taking or plan to take to implement these criteria. This grace period will be applicable for 6 to 12 months. Where there is no evidence of planning or progression at audit, the provider will receive a partially attainment with a relevant risk rating assigned, including a time frame for mitigation. A longer grace period will be implemented for criteria that is unmapped or new. This grace period may be 12 to 18 months. The provider will be required to evidence a documented action plan and implementation strategies to meet the criteria. Where there is no evidence of planning or progression or audit, the provider will receive a partially attainment with a relevant risk rating assigned, including a time frame for mitigation. Transitioning to new and partially mapped criteria. Mapped criteria are explicit or intended in the previous standard. Continue to be audited as usual and attainment aligned with current audit practice. A partially mapped new criteria are not explicit in the previous standard and or have a new component added in Ngā Paerewa. Short grace period will be implemented for partially mapped criteria. The provider will be required to evidence what actions they are taking or plan to take to implement these criteria. This grace period will be applicable for 6 to 12 months. Where there is no evidence of planning or progression at audit, the provider will receive a partially attainment with a relevant risk rating assigned, including a time frame for mitigation. Unmapped or new? Criteria are new and cannot be mapped to current requirements. A longer grace period will be implemented for criteria that is unmapped or new. This grace period will be 12 to 18 months. The provider will be required to evidence documented action plan and implementation strategies to meet criteria. Where there is no evidence of planning or progression or audit, the provider will receive a PA attainment with a relevant risk rating assigned, including a time frame for mitigation. Official mapping analysis compares previous standards with the 2021 standard, showing which criteria have changed and which have stayed the same. Mapping the previous criteria to the 2021 standard for hospice service providers indicates that 73% of the criteria directly map, 12% partially map, and 15% do not map. To support providers to plan and prepare for updated audit requirements, the Standards Criteria Application Framework gives a sector-specific overview. Please take a moment to open the documents listed on this slide to reference during the standards subsection and criteria summaries. Criteria between the existing and updated standards fit into 3 different categories. Mapped. The 2021 criteria directly map to criteria in one of the 4 standards. The criteria are either the same or have the same intent. The wording may differ slightly. Partially mapped, the 2021 criteria partially aligned to criteria in one of the 4 standards. The 2021 criteria are either similar to current criteria or are the same as most of the current criteria, but with an additional element. The wording is likely to differ because of the 2021 criteria reflect current accepted best practice. Not mapped. The 2021 criteria do not map to criteria in any of the 4 standards. The criteria are new to the 2021 standard and have been added to assure safe services to New Zealanders that reflect updated models of care. Of Section 1's 10 subsections and 56 criteria, for hospice service providers, only 8 subsections and 47 criteria are applicable. 3 of the 47 criteria are partially new, and 7 of the 47 criteria are new. Of Section 2's 5 subsections and 43 criteria, all subsections and only 37 of the 43 criteria are applicable. 5 of the 37 criteria are partially new, and 8 of the 37 criteria are new. Of Section 3's 8 subsections and 53 criteria, only 5 subsections and 39 of 53 criteria are applicable. 9 of the 39 criteria are partially new, and 5 of the 39 are new. Of Section 4's 2 subsections and 15 criteria, all subsections and criteria are applicable. Only 1 of the 15 criteria is new. Of the 5 subsections and 30 criteria of Section 5, all subsections and criteria are applicable. 3 of the 30 criteria are partially new, and 3 of the 30 criteria are new. Of the 4 subsections and 24 criteria in Section 6, 3 subsections and 14 criteria are applicable. 2 of 14 are partially new, and 2 of 14 are new. To summarise the key points of this presentation, we are all learning the refreshed requirements of Ngā Paerewa Health and Disability Services Standard together. Evidence is required that service providers are forming relationships or connecting with the local mana whenua of their region. Health Cert, the Ministry of Health, are committed to a non-punitive approach to transitioning to the new standard. There will be grace periods for partially mapped and unmapped new criteria. So where to from here? So Ngā Paerewa has been designed with the sector for the sector. Sector representatives are encouraged to provide feedback through the certification at health.govt.nz email. The monitoring and evaluation phase will run until May 2024. Training and development is part of the continuous improvement cycle. Resources are being developed to help support this learning journey. The standards have been redesigned to be responsive to sector needs. This slide contains a summary of the resources used in this presentation. For any further resources or questions about this presentation or the standards, please contact the Health Cert team via the certification at health.gov.nz email. Thank you for watching this presentation. Ngā mihi nui. In closing, please join us in the Manatū Hauora Ministry of Health karakia. Whaia, 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 ngā uratanga o te Manatū Hauora. Ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokore nei tahi, kia te ato tātou ki pai tata, ki pai tāwhiri, ki pai ora. Kia tuturu ka whakamoa, kia tina tina. Haumae, hui e, tākie.